Over 11% of U.S. adults took medication for depression in 2023, and those numbers have only increased in the past 2 years. But what happens when a patient comes off antidepressants? About 1 in 6 people will experience withdrawal symptoms such as nausea, dizziness, although others may have even more intense symptoms. That's where Outro, a new telehealth program, comes in. They pair patients up with doctors and pharmacies to produce custom antidepressants in tiny doses, which will help ease up withdrawal symptoms. Let's bring in NBC medical fellow Dr. Akshay Syal to tell us a little more about this. Dr. Syal, I will start. I was talking in the break. I am someone who has major clinical depression. I have been on antidepressant medication since I was about 15. Don't want to rat on myself, but I'm 35 now. So I am basically like a pharmacy. Like, I've tried it. I've been on different dosages. I have had the 2+ weeks. Can we change it? Can we come off of it? It is a process. And we know people who have taken antidepressants for an extended period of time, they can often have pretty severe withdrawal symptoms. Talk to us about the data here. Does the data show how long a person has to be on them to experience withdrawal symptoms? Can you just stop cold turkey if you decide on your own you're ready to make a change and not be on it?
Well, first of all, Ellison, thank you for sharing that. I think that story is going to resonate with a lot of people. It's something that I hear in my practice all the time. I do prescribe these as an internist here at UCLA. But, Ellison, this is a hot topic in medicine right now, right? This sort of coming off of antidepressants. There's a lot of emerging data coming out. First we were sort of figuring out, just how big of a problem is this? And then we started to look at what are the symptoms. And then, ultimately, how do we really treat it? And that's where that telehealth company that we'll get to in a minute is really looking to solve here. But, for those who don't know, really what we're talking about are antidepressant medications like SSRIs or SNRIs, medications that sort of affect the neurotransmitters in the brain. So, Ellison, when you think about what symptoms that can cause, you can get nausea, you can get problems with your dreams, you can get sort of irritability, and the withdrawal itself can actually cause anxiety and depression, which is the whole reason people take those drugs in the first place. And so to answer your question, Ellison, really what we're learning is that it can take as little as being on them for 4 to 6 weeks for these symptoms to start. And really, the longer you're on them, the more likely you are to have withdrawal symptoms. Now, there is some sort of good news here. We have a graphic here with, some drugs that are more likely to cause these symptoms and some drugs that are less likely. If we could just pull that on the screen here, you can see really I just want to highlight the least likely. It really has to do, Ellison, with the half-life of the drug, how long the drug is sitting in the body. But on the bottom of your screen there, Prozac is the one least likely to cause these. On the top, the more likely, really Paxil being the worst offender, Lexapro, Luvox, and Zoloft, of course, on there as well.
Explain to us, for people who don't know, why there would be a market or a need for a company to say, okay, here's kind of like an in-between to wean it off. Like, I look at that list. I have been on Zoloft for quite a while. At one point, I was on 100 milligrams. After being on that a couple years, I had a conversation with my doctor about how can we maybe back off of it a little, because I was having other side effects where I was like, I'm sweating all the time. Like, what's happening? Can we change this? And when we went through that process, we wanted to come back down to a lower dose, to about 50, but there was no, like, real in-between. So they were like, I can prescribe you 50 or 25 milligram, or you can cut the 100 in half, or like a third, but it is kind of tricky. Why is that true of every single antidepressant that is out there, that there's gaps in what maybe you would need to come off of it? Why do we need a company like this?
That's exactly it. And I bet you were thinking, Ellison, is this guy just making this up, right? We don't have clear guidelines as far as how to come off of these. So you'll see a lot of different doctors have different ways to do it, usually reducing the dose in increments over a span of weeks. But Ellison, this company here, Outro, was co-founded by a guy, Dr. Mark Horowitz. He's a psychologist or psychiatrist out in the UK who's kind of leading the effort here in antidepressant, coming off of them. You can see some of the symptoms on your screen there that we spoke about earlier, really dizziness, lightheadedness, vivid dreams or nightmares, and flu-like symptoms. But Ellison, the thing that really, the reason for this, right, to answer your question, is that people are often left to go on internet forums, right, places like Reddit and other forums, because they don't have clear guidance from their doctors, and it is something that the organizations are working on to come out with more clear-cut guidance. But a lot of the doses that are going to be prescribed in Outro, Ellison, are custom doses at compounded pharmacies that aren't available commercially. So that, to answer your question there.
Really fascinating stuff. Dr. Akshay Syal, thank you so much. We appreciate you.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app, or watch live on our YouTube channel.